Now, the World Health Organization says Israel has agreed to a series of limited pauses in fighting in the Gaza Strip to allow a polio vaccination campaign to go ahead. The militant group Hamas has also agreed to the plan. WHO officials say that more than 1 million doses of the vaccine have already been delivered to Gaza and more are on the way. Health workers hope to treat more than 600,000 children starting on Sunday. The war in Gaza has disrupted routine vaccinations and destroyed medical facilities, allowing polio to return.
Well, I'm joined now by Sam Rose. He is in Gaza. He's Deputy Director of the Agency for Palestinians, known as UNRWA. UNRWA is also in charge of the polio vaccination campaign. Sam, it's good to have you with us. The goal, of course, beginning Sunday, is to vaccinate more than, 500,000 children under the age of 10. Talk to me about the logistics here. I mean, how is it even possible in a place where next to no one is living in a place that they would call home?
Absolutely. Thanks for having me on. Look, it's very, very difficult in the same way that doing anything right now in Gaza is difficult. It's been difficult to get the vaccines in. They are now in. It's difficult to move them around. We've only just heard last night that the pauses that we've been calling for so long have now been agreed to. We welcome them, and we've got to go through detailed planning. And UNRWA will be administering about half of those vaccines to half of the children. We'll be doing it in our health clinics. That's what we would normally do in any given year. And last year, we vaccinated 99% of children. But most people now aren't where they were when we were doing those vaccinations, which is why the outbreak has broken out, or one reason for it. So we'll be vaccinating some people in our clinics, but otherwise in mobile health points that we've set up in tens of schools that are functioning as shelters. And then we'll be going tent to tent with our monitors, with our vaccinators, with our registration clerks to vaccinate the children. Like you said, all children under 10 need to receive 2 doses of the vaccine.
Sam, talk to me about how this was even able to happen. The fact that we've seen polio emerge in Gaza. I mean, most people watching would assume that polio has been eradicated completely.
Absolutely, and it was eradicated from Gaza. There have been no cases of polio in Gaza for the past 25 years, and this outbreak is a direct result of the conflict and the kind of multiple interrelated elements of the conflict in terms of the decimation of the health sector, hospitals, health clinics that have affected our ability to provide vaccine coverage as we would normally do. It's a consequence of the bombardments, of the destruction of homes, of infrastructure, the fact that so many people are on the move and now living next to, piles of sewage on one side and mountains of rubble on the other. It's a consequence of the malnutrition, as your report said, and it's a consequence of immune systems being so suppressed by what people, and in this case children, have had to go through on a daily basis in fear of their lives for the last nearly 11 months now.
I know in some places around the world there is this reticence among parents to have their children vaccinated for anything. I mean, do you expect to see any of that there in Gaza? I mean, untrusting parents?
I mean, misinformation is a feature of our lives these days. But look, what I can say is that vaccination coverage in Gaza has always been excellent. Like I said, the eradication of communicable diseases until now, largely because of the solid health system that we have in place, including UNRWA, which is the largest primary healthcare provider in the Gaza Strip. We as UNRWA are very much accepted, embedded within those communities. So there's a high degree of trust in health workers. There's a high degree of trust in UNRWA staff and in the vaccinators from our other partners who will be working on it. So we are working closely with community leaders, through mosques, through social media, to get the message out. We're confident that any misinformation that exists we'll be able to counter.
Sam Rose with the UN Agency for Palestinian Refugees. Sam, we appreciate you taking the time to talk with us. You're doing some valuable work beginning this weekend. Thank you.